So we're going to give you 60 seconds each to run through yourself, who you are, a little bit about your company and opportunity, and again, maybe your superpower if you want to do that.
Buddy, I'm Paul from Eyenuk, Chief Commercial Officer. At Eyenuk, we're developing and have an FDA cleared AI software for the autonomous detection of diabetic retinopathy. And we are right now currently developing a sort of a platform for the future at the point of care for large chronic diseases that affect the population at large beyond just diabetic retinopathy. And just in short, diabetic patients right now throughout the globe, about half of them are not getting screened. It's the leading cause of blindness in working age adults. We have the opportunity at the point of care to use AI software to analyze fundus images or retina images in 30 seconds and get these patients the treatment and the care that they need. So it's a pleasure and an honor to share this panel with everybody, and thank you for having us.
Summarize the key message that you would tell in this very short period of time you have of your clinical and economic value propositions, and make sure you tell us if you're reimbursed or if you're just an enterprise sale that's going to just fit into the overall economics, and explain that business model. So it's really ultimately business model that we're kind of going after here, as well as the benefits.
So I'd like to just have sort of everybody imagine the patient journey for a moment. If you think about patients right now, where we are FDA cleared is for patients that are diabetic. And these patients are recommended to get their annual eye exams once a year. Again, it is the leading cause of blindness in working age adults. It is a global problem, not just a US problem. And essentially, the issue you have is patients are getting diagnosed with diabetes in their primary care clinics. They're being given referral to go to an eye care specialist to go then and get their screening for their retina screening for diabetic retinopathy. Half of these patients are not making it to the eye care specialist. We could have a whole nother panel on why they're not making it, but they're not making it. And so if we have the opportunity to take this fully autonomous software technology, put it at the point of care where the exam can take about 5 minutes or less, we can get an AI diagnostic result within 30 seconds. And then we can give you a level of detection where it's just a more than mild detection, or it actually can tell you if it's vision threatening, where then you can prioritize these patients for follow-up treatment, whether they need to get to a retina specialist because it's critically urgent, or maybe they just need to go for eye care follow-up within a couple of months. And so we can get down to that level of detail. And so, as an anecdote, we have started to build case studies, and we've done one recently through our connection and relationship with the University of Nebraska, where we had one of their clinics, and in 1 year, they saw almost a 40% increase in compliance with their diabetic eye exams. And so these patients now are able to stay there on the spot and get this screening, and then follow-up treatment can then follow. And so we are really in the business of eliminating preventable blindness. And when you think about the value proposition, when you couple that clinical benefit, we have a very accurate and safe technology. It's been proven in over 200,000 patients as it's been studied. But when you think about the economic value proposition as it's layered on with the clinical value proposition, from an economics perspective, value-based care is only becoming more and more prevalent in our healthcare system. And a lot of these clinics and primary care offices are incentivized from HEDIS and from MIPS and quality care scores for them. And diabetic eye exams is one of the ones that they struggle with the most from a primary care clinic perspective. So there's economic incentive for them to hit these value care gaps, along with a level 1, category 1 CPT code as well, that also covers the technology. So from an economic perspective, it's viable. From a clinical perspective, it's safe and accurate, and it gets them at the point of care, which gets them the treatment. And hopefully we can eliminate preventable blindness because there are treatments for these patients. So hopefully that sums it up for you.